are still joining us. But a big hearty welcome to all of you joining us today. My name is Margaux Stack-Babich, and I'm the Community Outreach and Engagement Coordinator for the Morse Cancer Center at UC San Diego Health. And I'm thrilled to be here with my colleagues today at the California Immunization Coalition. We work together to bring this conversation to you, featuring some really spectacular experts on this critical field of vaccine communication. The title for today's talk is Vaccine Communication, Inoculating Against Misinformation. I think now more than ever, that topic is something that so many of us in the public health field, in the field of medicine, are so keenly urgent to figure out and to try to address and mitigate. And I just want to give a quick shout out to the California Immunization Coalition and tell you a little bit more about them if you're not already familiar. They are a 501c3 nonprofit public-private partnership that's dedicated to achieving and maintaining immunization protection for all Californians to promote health and prevent serious illness, disability, and death. So if you're meeting them for the first time today, they're a wonderful organization. And I'll just mention our work group as well, San Diego PATH. This is a specific work group out of the Cancer Center that's focused on the elimination of HPV-related diseases in our community in San Diego, but of course, beyond our community as well. So we have a particular interest in demystifying and debunking vaccine mis and disinformation over here. So we are natural partners with the California Immunization Coalition. I just want to quickly address some of the basics on Zoom. I know so many of you are seasoned experts, but just to remind you, we're in a webinar format today, so you're in a listen-only mode. So you should be able to hear everything. You won't be able to speak. So you should be able to pick up everything through either the computer audio or by dialing in, and you can get that information in the calendar invite that was sent to you when you registered. And so just to give you an opportunity to participate, of course, if you have questions for our presenters or for the team on the call throughout, you'll see the Q&A option in the bottom bar of your Zoom, so you can submit questions to the presenters and hosts through this mechanism. And just again today, I'll be hosting this conversation and with my colleague, Dr. Eric Ball. Dr. Eric Ball is affiliated with the Southern Orange County Pediatric Associates and the Children's Primary Care Network as well. And so I'm going to be passing the baton to Dr. Ball toward the end of our presentations today to really expertly field the Q&A that some of you have already submitted and that we hope you'll submit over the course of the conversation today. So let's get into it. Our first speaker today is Dr. Alex McDonald. Dr. Alex McDonald is a family physician and a sports medicine specialist at Southern California Kaiser Permanente Medical Group. And particular interest today is that he's the co-founder of the This Is Our Shot campaign. And so we'll let Dr. McDonald get into what that campaign and the organization is. So thanks so much, Dr. McDonald. We'll give you the mic.
All right, thanks so much for having me. I thought I was going second, but that's okay. We can go with this here. So let me pull up my slides here and share my screen. All right, can you see my screen? Is it in full mode?
Yes.
Because oftentimes I present it and it's in like half screen mode. So that's always good.
Looks great.
So thanks so much for having me. I'm really excited to be here. I'm going to talk a little bit about This Is Our Shot and Vacuna Teya, and then a little bit much more about social media and vaccine information as well too. So I don't have any disclosures, but I do have to say that my 3 children have all been fully immunized against all routine childhood illnesses, as well as COVID-19, including their bivalent COVID booster last month. So I guess that's my only disclosure I have to. So why is social media important, and why am I really passionate about using our voice on social media as a trusted messenger? And that's what led to This Is Our Shot. We're going to talk a little bit about misinformation disorder, misinformation use disorder, and then also I want to talk about just some ways that you can actually be more effective on social media when it comes to creating impact, creating messaging as well too, and sort of that grassroots approach too. So the biggest question is, why social media? And the reason is that this is where a huge amount of people are getting their information from. If you look at some of this information here from Pew Research, especially younger individuals, 18 to 29, 42% of individuals get most of their news from social media, or most likely to turn to social media. Now, obviously, as you accumulate birthdays over time, that number diminishes, and traditional, news websites or apps become predominant in those over the age of 30 to 60 as well too. But the point is, this is kind of where information lives, and it's also not filtered as well too. So if we really want to be part of the conversation, we need to be on social media, essentially, overall too. So, this was a study that we looked at earlier in the pandemic, when vaccines were first a thing, or COVID vaccines were first a thing. A study done by the Kaiser Family Foundation said that most people, 80% of individuals, would turn to a doctor or a nurse or somebody like them as the most trusted source of information as well too. So, the problem is a huge amount of adults and individuals remain less than fully vaccinated against COVID. Most individuals have not had their bivalent booster, and we have a misinformation gap. We have a knowledge gap as well too. There's a lot of things going into this as well too. But the part of the issue here is that you are the solution. You are the trusted messenger, not me, not Fauci, not a political figure. Your own individual nurse, doctor, or healthcare professional is the most trusted source of information as well too. So I want to talk a little bit about This Is Our Shot, and kind of who we are and what we did. We basically were sort of this grassroots collection of individuals who really saw the importance of social media and sharing the message, and really helping to elevate the voice of trusted messengers. And so this is really our vision, is to be kind of a support system to encourage, to educate individuals to share accurate, trusted information as well too, because it's not about the other patient's doctor, it's about your patient's doctor or nurse as well too. And so building community, really providing resources and education about how to be most impactful, really then building that digital impact, and then ultimately helping create a healthy world overall too. So that's a little bit of our theory of change as well too. This is kind of the same thing. So what we've done recently also is taking a lot of information and kind of done some work with the Stanford Internet Observatory and the CDC about what information, what misinformation seems to be popular and trending on social media, and then helping provide some counter messages so that we don't always have to, all of us individually don't have to recreate the wheel. Again, giving some training, giving some tools, and then we all are sort of like those digitally activated heroes, so we can be most effective as well too. So how's it going? I mean, there's about 15 of us of this core group, which is partnered with 68 organizations. We've trained over 4,000 individuals, and we've created billions of impressions on social media as a result of this work, which I'm really proud of as well too. So the key is collaboratively, we all can work together and we can make an impact. Any one of us individually, it feels sort of overwhelming sometimes because there is just so much out there. But collectively, if we kind of, I like using the Nemo school of fish analogy. So anybody, I have 3 kids, as I said, I've seen Finding Nemo a million times. And there's that one scene where all the fish are caught in the net. The school of fish are caught in the net and they're all swimming in every direction. And Nemo says, everybody swim down. And all the fish start swimming in one direction and they break the net open and they all swim free. And so our goal here is to take all of those trusted messengers who are the school of fish and have us all swim in the same direction to have the most impact overall too. Okay, so I want to talk a little bit about misinformation as well too. So, there's multiple types of information and misinformation. There's kind of 3 buckets you can kind of put it into. Is there's misinformation, and that's false information, but it's not necessarily created with a malicious intent to cause harm or do anything wrong. It could be, partial truths, or, it was shared before it was really sort of known to be fact. So that's kind of the misinformation piece. So false. And then there's disinformation, which is information that's false and deliberately spread to create or harm a person, a group, or a society. And this is what we're most worried about. And then there's malinformation, which is just, not based on reality and really focusing to intent harm on some individual or group as well too. So, misinformation exists, but disinformation, I think, is the biggest player right now too. And again, if we all can kind of think about where we impact and where we can have impact here as well, I think that's going to be helpful. So keep those kind of three buckets in place, but we're mostly going to talk about sort of misinformation and disinformation here as well too. So and I think it's important to remember that not all misinformation, it has the same level of harm, right? There's a lot of satire or parody or comedy out there, which is technically misinformation, but it's sort of poking fun at an issue, or it's to raise awareness about an issue, and it's not really intended to cause harm or to fool anybody. And then there's just pure fabricated content, which is 100% false, trying to hurt somebody or to try to financially gain somebody else as well too. And there's all different levels of shades of gray in between there as well too. So I think it's important that we sort of think about that it's all shades of gray. It's not necessarily black and white. And there is some mis and disinformation that is more harmful than others, but it's not all created equal as well too. So I think that's an important thing to think about when we're doing this. As we move along. So what makes us vulnerable to misinformation? Unfortunately, just the way we're built, misinformation tends to spread a lot more readily and rapidly than actual truth and fact, because unfortunately, truth and fact is kind of boring sometimes, whereas misinformation and disinformation is designed to sort of tantalize the senses and go viral as well too. So, there are a lot of motivational factors. Insufficient reasoning or attention. How many of us have shared an article without actually just reading the title and not actually reading the content of it as well, right? Sometimes there's just not enough hours in the day as well. It feels good to share, right? Everyone's sharing this article, and so you want to share it as well and be part of the team. There's a lot of social incentives to sometimes share mis and disinformation as well too. There's definitely some individual psychological factors as well too. There's cognitive bias. There's hedonistic factors as well too. We sort of tend to we like things which sort of reinforce our own worldview and makes us feel better about ourselves, and that cognitive bias. And when information doesn't fit within our schema, there's some dissonance there, which makes it harder. Sometimes we just get mad and angry, and our emotions take the better of us as well. And there's a whole bunch of different motivating reasons individually that people do this as well for their own personal gain or their own sort of popularity as well too. There's a lot of well, I'll talk about this in a bit as well too, but there's a lot of sort of how shall I say this, sort of narcissism and self-interest and sort of grandiose, crazy ideas out there too. And those tend to get more likes and more clicks and more follows. And as a result, that sort of provides this feedback loop of like, I put out this crazy tweet, which is not based in reality, but I got 100 new followers. And so I'm going to keep doing that as well too. And so reasonable people can actually sometimes be misled by their own sort of motivation to try to get more information and build followership on social media as well too. And then there's a lot of socio-technical factors as well. So information is constricted. You're only getting your news or information from one source. There's definitely the echo chamber, which social media is very good at. Unfortunately, we tend to like things which fit our schema and create these sort of bubbles in these groups where we just tend to share the same information within the same people and reinforce our worldview. And then there's also just information overload, right? There's just too much information. I don't know what to believe. And so I'm just going to like kind of go to the lowest common denominator as well too. So there's a lot of issues about which makes us vulnerable to misinformation and disinformation. And really the key here is who spreads inaccurate information. We all do, right? Everyone raise your hand. We all are guilty of this, whether we want to or not, despite our best intentions. The way we're sort of hardwired makes us all vulnerable. So, everyone shares misinformation or disinformation at some point on social media, despite our best efforts. The government and politicians are notorious for it. Industry has their own sort of biases as well too. Private messaging apps and the social media companies themselves have their own incentives as well. And the media, despite some trying better than others to share accurate information, everyone is sort of subject to disinformation is the point here. So it's all of our responsibilities to be aware of it, to be aware of our own blind spots, kind of what makes us most vulnerable, and then try to be active participants to be more to combat mis and disinformation as well too. So there's a lot going on right now on social media, especially with Elon Musk taking over Twitter. There's a whole bunch of mis and disinformation, which is thriving on that website. And I thought this was kind of interesting that I'd share this. Merriam-Webster's word of the year was gaslighting. And in the age of misinformation or fake news, conspiracy theories, Twitter trolls, and deep fakes, gaslighting has emerged as a word for our time. And so, sometimes if people repeat false information enough and they hear it from enough sources, they begin to believe it, even if it's completely false. And so just trying to be aware of that. There's a lot of drama on Twitter right now. I'll just throw it out there. I use Twitter. That's actually probably the main platform that I use the most, quite frankly. So, but part of the issue is Twitter has laid off thousands of employees. They've actually stopped their COVID misinformation policies as well. And basically as a result, things like this happen. So now Twitter stopped enforcing its COVID misinformation policies. I can finally tell you the vaccine doesn't work, masks are useless, and lockdowns did more harm than good. Thank you for coming to my TED Talk. So that's, one quick example right there of kind of what's happening when social media companies stop enforcing policy or don't have a good policy. Mis and disinformation, unfortunately, thrive as well too. So not that you shouldn't use Twitter, but you should be aware of this, I think, is the biggest issue overall too. And definitely expect a rise in mis and disinformation overall as well too, within social media. Now there's some information here too. So once they stopped enforcing their once they implemented their COVID misinformation policies, this was back in mid 2000 in July. Several accounts were challenged here, looking at spreading mis and disinformation, and then numbers plummeted once the policy was enacted as well too. If you look at the number of accounts suspended, also due to Twitter's prior policy, a lot of accounts were actually suspended because they were deemed to spread mis and disinformation as well too. And then a lot of content was actually removed. You can see how much content was removed due to these policies as well too. So the point is these policies were working. They were making a difference. Now, where do you draw the line between what's misinformation and what's disinformation? And to my point earlier about a lot of shades of gray, this can be very challenging. And so that's why it's important to have sort of a nuanced approach and a team approach as well too, so we can make sure we're not censoring people, but we're also providing good information. And here's the other thing, which has been really concerning. Once Elon Musk took over and they stopped this, hate speech rise significantly on Twitter. And so I think the bottom line here is we need to help have social media companies be held responsible for their role when it comes to spreading mis and disinformation as well too. I think the biggest thing here, and when it comes to sort of vaccine hesitancy, whether it be COVID or flu or HPV or you name it, any vaccine, when it comes to messaging, it's not an all or none concept, right? There's people who accept everything, done. There's people that refuse everything, done. And then there's the kind of the 60 to 80% in the middle, and that's really the group we're kind of aiming at. So that they don't want the vaccine, but they're not too sure. Those that sort of want to wait and see, and those that will accept vaccinations, but they're not sure. They have some questions first. And so I think that's the key here, is that we can't think of it as all or none. And if we don't say anything, then this whole group in the middle here wins, essentially, or not wins, but this whole group in the middle is not going to be vaccinated. Whereas sometimes it can just be a small conversation. It could just be a small comment on your way out the door. Oh, by the way, hey, get your flu shot. It's going to protect you and your family from getting really ill, potentially ill this winter. Something as little as that can push this group over here on the accept, I'm not sure, push them into getting vaccinated. Versus if you don't say that comment, they're not going to get vaccinated. And so the threshold for getting somebody vaccinated is a lot higher. And when it comes to disinformation, it's a lot easier to convince someone to do nothing than it is to convince someone to do something. And so the activation energy can be challenging to overcome as well too. But this is what I'm so proud of about This Is Our Shot, and a lot of the social media movement that occurred early in the COVID vaccination phase here is we all shared our stories. We all took a private act of vaccination, which was really to protect us and our patients and our families, and we made it a public display to show people this is important, this is worthwhile doing. I'm getting vaccinated, you should get vaccinated too. And I think that's really the collective power. This slide gives me chills every time I see it, just because it makes me think back to, I have a lot of emotional baggage tied up in the last couple of years. I'm not going to lie, it was challenging for all of us too. But I think this is the importance and why we all need to speak up too. Okay, how am I doing on time? Okay, about 5 minutes left. So really creating impact. I'll go through this really quick and then we can answer more questions later. It just takes a minute to sort of create a profile, to be active. Just pick a platform. You don't have to be everything to everyone, but find out kind of where you're comfortable. If you already have a Facebook account and you want to start using that, great, go there. If you wanted, if you're under the age of 30, because apparently genetically you can't get a TikTok account unless you're under 30. No, I'm just teasing. You want to do more videos and things like that, go for TikTok. But every platform is a little bit different. And so start where you're most comfortable, and then you can expand from there when it comes to being a trusted messenger. I think it's important to try to have a framework. You obviously need to be professional. You should be deliberate. Obviously, you need to be ethical and accountable, just like you would information in the exam room or in the hospital or wherever you work. Make sure those same rules sort of apply to the social media space. And then I like using the newspaper test. If I don't want this splashed on the front page of the LA Times tomorrow morning, I'm probably not going to post it on social media. And so those are kind of the five biggest rules that I really think about when it comes to using social media to be most impactful and to protect you as well too. So this is kind of who I am. This is how I use social media. I practice family and sports medicine. I work at Kaiser Permanente. I believe a lot in health equity and health policy as well too. And I'm kind of goofy in my social media account, has lots of goofy pictures of me having a good time. But you have to figure out kind of what works for you and what your kind of message is. Think about finding your community, right? Whether that's family, whether that's friends. Who are you? What group are you? Are you a member of the PTA or a member of a synagogue or a mosque or a church that you want to help kind of have these conversations? Are you part of a fitness class where you want to have conversations? Wherever you're a member and you're part of a group and a community, you can have impact when it comes to sharing accurate health information as well too. I think when it comes to sort of the social media algorithms, it can be very confusing. Really, consistency is key. You don't have to post every single day, but trying to post, 1, 2, 3 times a week can be beneficial. Pictures, videos are very popular right now, and will kind of bump things farther up the algorithm and more likely to see whatever content you're creating. I think it's really important to make it personable. That's the value. And one of the things that I love most about social media is you can be your authentic self and really share your story, which is so much more impactful than just sort of, a soundbite or organization or things like that. I think it's important to be timely and provoke emotion as well too. That can be anger, fear, sadness, whatever it is. When you provoke some kind of emotion, you tend to have a greater impact as well too. But again, don't use fear. A lot of the anti-vaxxers and individuals trying to share information rely on fear quite a bit, and we don't want to go there. We want to stay positive. And then also, like I said, kind of talking about redefining your community, be it in-person community versus online digital community as well too. Again, whatever your personal brand is, kind of pick a few things. You don't want to you don't want to, I'm a family doctor. I do a little bit of everything. I get distracted, but you want to try to stay focused on a couple things that sort of areas you want to stay interested in. One of my friends is an ophthalmologist, a mom, and she loves coffee. And those are the only 3 things she posts about, but that's okay. And that's kind of who she is. And as I mentioned, sharing your story and making it personable. Lastly, do not feed the trolls. If somebody posts something, just ignore it, block it, don't engage, because all it does is it bumps up their views and their algorithms as well too. So if somebody makes a comment or shares something, just don't engage, ignore it, stay positive and can stay on your own message and just ignore the riffraff, so to speak. That's really, really important. And this is just some examples of some of what our social media team has done over the last several years. I kind of talk about this overall, speak in the first person, be professional, and have fun. It's great. I've connected with many people, including Dr. Wolynn here, on social media, having never met them in real life. But we built that relationship and that trust over time as well, too, which I think is really kind of amazing piece. You can kind of find your community online as well, too. We'll jump through here. Talk about that. I'm running short on time. So really, join the conversation, share, Tweetitrition, FM Revolution, this is our shot, vaccines work, get vaccinated. There's a whole bunch of hashtags out there regarding vaccines. So definitely, feel free to engage in those and see which ones work for you overall too. And so that's all I got. Really, this is my closing thought here is the work as a physician or a healthcare worker, a nurse, a pharmacist, any kind of a healer really can't stop at the door of an office or the threshold of an operating room or the hospital. We really need to continue to get out there and spread our voice as trusted messengers beyond the hospital and the clinic. Yes, we should do it there as well, but even beyond those doors. And I like thinking of social media as kind of a tool in the toolbox overall that can make a difference too. All right, that's all I got. Sorry, I'm running out of time. I apologize.
Thanks so much, Dr. McDonald. That was fabulous. And we fully recognize that this is an all-day conversation. We have enough to cover multiple days, I think, easily on this topic. So we appreciate you trying to condense this down into just 20 minutes. And the same I know is true for our next speaker, for Dr. Wolynn. Dr. Wolynn is a pediatrician. He's the CEO and the co-owner of Kids Plus Pediatrics out of Pittsburgh. And he's also the co-founder of Shots Heard Around the World. And in the similar spirit of the organization that Dr. McDonald just described, we're really excited to hear more from Dr. Wolynn about the creation of Shots Heard Around the World and what it is and what it does. So Dr. Wolynn, the floor is yours.
All right, I'm gonna take over the screen if that's okay. Whoops. All right, let's do this. You guys can see my full screen now? Okay, thank you guys for having me. Sincerely thrilled to be here. And Dr. McDonald rocks. I'm going to be talking about very similar stuff, but from my own angle. I'm going to go fast because we do have a limited amount of time. So ready, set, go. Boom. Let's see. Ooh. There's my advance. Okay, there's my disclosures. I'm not going to be saying anything that's off label because I'm not talking about anything labeled. I'm talking about communication today. But I do a lot of consulting and speaking. All right, ready? I'm going to be provocative. Safe and effective vaccines don't work. True statement when people don't trust them. And we are losing the trust battle right now. And as you heard Alex say, we are trusted as healthcare professionals, but people aren't trusting vaccines right now. And obviously we'll get into this. So I'm a general pediatrician, right? So we're a little bit different in our angle on healthcare. A lot of people think when you do pediatrics, you do your well visits, people get, they get shots, measurements, and forms filled out, or they come in with symptoms and we have to decide, they're sick enough to go to the ER, do they need a prescription? But if you really boil pediatrics down to that, you are missing the special sauce. And that was exactly what Alex was talking about. We have all this ability to leverage the trust that we have with families, but are we doing it? So as you heard, I'm the CEO of Kids Plus. I'm a pediatrician. I was a lactation consultant for 25 years. The Well is a group meeting place we have during pandemics. It's a great mass vaccination room. We have 3 offices throughout the Pittsburgh area and about 100 employees, 110 employees, and about 20 providers. We are known for our quality, our connectedness, and our communication. That is Evidence-Based Studios. That sits inside of our office. We made a commitment. We actually have a full-time communications director, which is weird, right? A lot of people are like, wait, you're just pediatric practice. Why do you have a communications director? I would argue he's one of the most, or if you have a she, would be one of the most important people on your team. And I'm going to explain further as to why and why that is becoming more of a trend for people to do communications and media. He's incredibly skilled. He taught communications at Carnegie Mellon University, does audiovisual writing, fairly sophisticated. But I do want to point out, you don't need a communications studio in your practice or in your hospital or in your healthcare setting. a teenager and one of these can do everything we do in there and do it well and can get millions of followers if that's what the goal is. But they can certainly communicate effectively just with a smartphone. So let's get rid of that. So, okay. So our story real quick, started in August of 2017, we put out an HPV public service announcement that was titled "We Prevent Cancer." And we leveraged the trust that is between providers and the community. So every one of our providers had a little snippet of time dispelling disinformation, that it only took one touch, one time was kind of the refrain, and that it didn't require intercourse, and that you could acquire the virus pretty early in life, and that it could go on to cause cancer, death. And we had a safe and effective vaccine that was available. And back then in 2017, the vaccine had already been approved for 11 years, and the CDC was still saying it was a top 5 priority to get the vaccine into arms, because less than 40% of women, and even way less of men, were getting, our boys and girls, as young as 9. So we put together that video, and it was pretty awesome. So we got 15,000 views, and people were calling and making appointments. It was doing everything we wanted it to. It was perfect. It was rocking. That was a Facebook post. And then one of the sister-in-laws and one of our moms in the practice, who said, "Oh, I love my practice. Look what they put out here," goes on to then put it into an anti-vax group, where then the views go up to over 100,000. It goes viral, and thus begins a really weird journey for us. What did it look like? This is what the attack looked like. It started on a Friday. Those are the number of accounts from Facebook that were attacking us. Each posting, multiple times, sometimes over 100 times. We had over 10,000 attacks on our Facebook page. They were from all around the world, but you know where they weren't from? Pittsburgh. No, because the anti-vaccine industry is a well-organized, well-funded now entity, and basically can quickly disseminate orders to attack where they want to send attacks. Now, that blue arrow represents reinforcements, and I will tell you a little bit more about that, because that was really the notion for what we did. So we're a fairly well-connected group. I do a lot of speaking nationally. I do a lot of work at the AAP. I actually happen to be at the American Academy of Pediatrics National Conference in Chicago. Started getting attacked, started asking for help, started telling people what was going on. And reinforcements did arrive right around that peak. So we're a sample size of 1, and the peak seems to go away when the reinforcements came. But we also have now reproduced this multiple times. And bullies, like anti-vax bullies, don't like getting pushed back. I hate to sound militaristic, but medical practices are soft targets. That includes hospitals. And when they get attacked by social media, they usually cower, and they get and the attacks can be pretty severe and pretty scary. And what happens is that it can cause what their goal is to cause you to be silenced, pull down the offending post that they really didn't like, and then never post again. And that happens more often than you'd think. Let me just tell you a little bit more about our situation. So we were getting screenshots from inside the attacking group saying, "Hey, dude, you better be ready. This is what's happening." And so there's positive pro-vaccine moles inside these groups who were sending us messages, and we saw that they then went on to target our Yelp and our Google reviews. Yelp took away the fraudulent reviews within 2 weeks. Google, that's another story. And when you see here the number 344, that's the number of days that it took Google to remove our final fraudulent review. Long story. I can't go all into it here, but you can't call or email Google. We eventually had to shame them. We went to the Guardian, had an article done where they grabbed screenshots of the fraudulent reviews, and then magically Google then decided to take the final fraudulent reviews away the next day. So Google sucks, and I will continue to publicly shame them every time I can until they have better policies. Anyway, where are we going with this? We've got a lot of coverage. Part of our initiative here was to get the word out. We were on the front of the LA Times, on the cover also of the New York Times Science Times. We've been in 3 documentaries. We've been published in peer-reviewed literature in Vaccine twice. Have another peer-reviewed publication coming out. We've had about 3 or 4 regarding social media attacks. We wrote a commentary for Nature Immunology. Been all over the place, though apparently that doesn't sway opinions like People does. So if you want to have your real impact, People. So this obviously is years after that attack. We've never stopped the work. As a matter of fact, the work has only grown for us. And now it's obviously spilled over to addressing attacks and disinformation, including around COVID. That is Chad, our communications director, and we did not take the cover. We actually took page 77. We gave Ricky Martin the cover of People. But again, one of our efforts is to just get the word out on how terrible this could be. And don't forget, 2017 is when this started for us. Now COVID rolls around, and obviously it took disinformation to a whole nother level. And Alex, helped you differentiate between mis and disinformation. So we're all to blame for spreading inaccurate information, but disinformation has an agenda, and it's important to understand that. So he told you we're the most trusted health profession. So nurses are up at top, physicians, and if you break them down by subspecialty, pediatricians are right up top, Sith Lord, then member of Congress, right? So healthcare carries great weight and great support, but we squander the trust. We squander it. We don't do anything. And I have to give credit to that joke to Mark DeMonte from the American Academy of Pediatrics, because that really was his, but it's a good one. So it's important to recognize the trust is not with the healthcare system. Even if you're in a really good integrated system like Kaiser or something like that, the trust really resides with the provider, and at least down to the level of the practice. So if messages are coming out from Kaiser or Mayo and they're talking about, car seats on one post on social media, but the next one's about gallstones and the next one's about hemorrhoids, who the hell's the audience for that? You need to have a robust dialogue and interaction with an audience that trusts you, that you give them relevant information without being too preachy. As Alex said, have fun with it too, which is what we do. So I want you to recognize there's a way to use social media and there's a way not to use social media and professionally. And that is really where we're at. It's no longer an option. In 2010, when we were out, Chad and I, doing grand rounds and lectures about the use of media and digital imprint, our footprint, we talked about how important websites were, and we were already on social media at that point. But we said, it's something you really should consider. In 2022 and beyond, you should consider it. You already heard what Alex said. That's where people get their information. So you really need to be there. And we'll talk further. So it's not the insurer, it's the provider, at least at the practice level. Now, again, we have longitudinal trust in primary care. We see people again and again. If you make recommendations, particularly if you've known a family for a long time, they oftentimes will just go ahead and do what you're asking. But again, we squander this. Why do we squander it? Because I got to get to the next patient. I got a chart. I got so many RVUs I got to generate. Well, let me tell you that we're missing the boat, not just in our impact, but I will argue you deliver lower quality care and you are less profitable if you aren't fully engaging this longitudinal trusted relationship. The kind of what's in it for me, right? Our CFO and CEO won't go for it. Baloney, they will if they understood this. And by the way, when we were on the cover of the LA Times, we got a call from a 9-person communications team working at a pediatric multi-specialty quaternary, like billion-dollar healthcare center, whose CEO and CFO told them to go silent on flu vaccines headed into flu season for fear of a social media attack. Think about that. They're not just scared about bad press gaining scores. They're now scared of social media attacks. And social media platforms have totally allowed things to go wacky. Their algorithms, as Alex told you, prize sensational disinformation and fantastical things, because nobody wants to hear 4,000 or 4 million people got immunized this week and nobody got hurt, right? That's the algorithms. We have some sway on that, not a lot, but we could have more if we start holding them liable for the content on their platforms, because right now they're shielded by Section 230 of some kind of like decency law. So they say we're only a platform, we don't create the content. That could be changed because we vote. And then the other thing is the role we play, which is vaccination advocacy, to stand up to the disinformation, because we have tons of trust, but we get attacked, and you'll see more about that. So at the end of the day, we are behavior change experts, right? We are trying to get people to do some of these or to do less of some of these. So think about your job, because ultimately it's behavior change. And you do that through good communication, but are you prepared? Hell no, you're not. They don't teach anything about communication, but this is what they teach: headache, palpitations, diaphoresis. Do you know the diagnosis? Let's throw in hypertension. Yes, that's right, pheochromocytoma. Every damn board you take, you will be asked that. I have nothing against neuroendocrine tumors or neuroendocrinologists, but why the hell are we drilled in that this is what you have to know and know it rote? because you'll have like 2 to 8 per million of these. That's the incidence. So you'll likely never see one. And if you miss the diagnosis and send to the hospital, the specialists will get it. But are you taught about things that are likely to occur, like breastfeeding or sleep or communication or vaccines? Not really well enough. And so we sit by this antiquated Dr. Marcus Welby, yeah, you probably don't know him unless you're older like me, TV show, kind of like, oh, we just have to teach the classics, right? That's crazy. That we aren't taking care of people in 2022 the right way, and thus why people are suffering unnecessarily. So here's the 2 communication, healthcare communication fallacies. Outside that door is 365 days a year. Inside the door is the 4 walls of our exam room or our clinic. And guess what? We are taught that you have to wait till they come inside the office when you'll then impart all your wisdom. Oh, your wisdom, everything they need to know. Like, it's not that the kid is crying and the sibling's late for a soccer game and the parents trying to figure out how they're going to feed their kids. But yes, we're going to sit down and take it all in. Everything. I mean, sunscreen and firearm safety and vaccine effectiveness, and we'll cover it all, right? Not. Gen Y, Gen Z, I would even now argue X and boomers want their damn information when they want it, where they want it, how they want it, which is often on a toilet in a bathroom or breastfeeding a kid at 2 a.m. Maybe I'm being graphic, maybe I'm being too provocative, but it's true and you know it. So yeah, baloney that we can only impart our information when they're in the exam room with us. That's just ridiculous. The second thing is you'll be believed. You may be trusted, but if they've already been reached with this information, you might not be believed, whereupon you will have to be really good at communicating to debunk the myth that they've already now been affected by. It can be done, it's harder, but you know what's better? Pre-bunking, meaning if you reach people before they get disinformation, you can make them more resistant, that's the title of today's talk, to disinformation. I have an article at the end. If I have time, I'll show it to you, or else we'll send it out to you. So yeah, that's all real stuff. If a tree falls in the woods, does anybody hear it, right? If you have important information to say and nobody really hears it because you're waiting for them to come to your office, do they really hear it? Not really. Okay, here's great news. There's this cool tool. It's called social media. It's the most powerful communication tool ever known. Like, it can overthrow governments and it can cause genocide, but it can also cause good things. Are we using it in a good way? No. Healthcare, the largest sector of the economy, has not really figured out how work with social media. Now, when I give grand rounds in person, I show them this kind of data. And I say, 2008, about 10% of people had social media profiles. 2021, about 79%. And if you really limited this in age down to like sharing age or people that would be involved with the child, with care of children, I bet you that number is like 99% now in 2022. I mean, it's clearly high. So I say when I'm in the audience, if you make hats, and you find out 79% of your target population wants blue hats, what color hat should you make? The answer is blue. Why are we not out there in a robust way? Because we're going to wait for them to come to us. This is what 1 year's time looks like on a pie wedge of hours per year. That's actually too big of a wedge, but I had to make it big enough for you to see. But these companies get it. They get the communication is behavior change, and they can use this to get you to go on a cruise, to stay at their hotel, to buy a $12 double pump mocha latte, right? They get it. There is what's called a positive return on investment. For every dollar spent, they can get more than $1 back in profit. Guess what? We can do the same thing in healthcare. We can actually get higher quality, higher compliance, better outcome healthcare by using communication to get sunscreen used, car seats used, smoking cessation. But are we using it effectively? Hell no. So yeah, I let my rants go on. So it used to be, if it bleeds, it leads. That was kind of journalism. Alex already talked to you. We tend to really gravitate toward threats. That's just what happens. It gets our attention. Now, I'll quote myself, if it scares, it shares. Yeah, that's the algorithms. That's what they use. Anything that's divisive or scary, we're wired for threat as humans. So we share it, we like it, which is part of why we spread misinformation too. We can't stop ourselves sometimes. So that's why they're hopefully now teaching kids to kind of be better stewards of real information and find out where the information came from. All I'll say is 24/7 disinformation is being thrown down and eroding this acceptance, hesitancy, or if you want to call it questioning or anti-vax, right? That's the number, 75%, 23%, 2% that has existed pre-pandemic. So our chance to kind of push them back toward accepting happens face-to-face, maybe an hour a year, probably not. And there's all this effort pushing them the other way. Are we there trying to do better? So face-to-face, You can actually be trained to speak better face-to-face, which we're not. But we also need to develop our own individual, or at least practice level social media voices to push it back up that way. Who benefits from improved vaccine communication? As I said, all of these can be made better. And we're currently working on collecting data on this, showing how you can improve compliance. So now your CFO and your CEO becomes a little more interested instead of scared of social media, as should your health plans and the manufacturers and everybody else, because there are billions spent on research and development. But what does it matter again if we're not using vaccines? So those are the people that stand to gain. Those are the people that stand to lose, right? The anti-vax industry, people promoting conspiracies. Now, this is a face-to-face communication tool. I'm going to give you the 1-minute breakdown really quick, because you haven't been trained to deal with hesitancy or questioning. So I say to Mrs. Jones, hey, Mrs. Jones, Susie's due for her TDAP, her HPV and her meningitis. Ms. Jones says, I'll take the first and third one, but that middle one, I'm not sure about HPV. Inquire, Mrs. Jones, you've been bringing Susie here for like 11 years. Please tell me what's going on. But my sister-in-law posted that one can sterilize kids. Mirror. Ms. Jones, let me make sure your sister-in-law posted on Facebook that the HPV vaccine can sterilize kids. You mirrored back to her after you inquired, her exact words. You took some time and displayed active listening. You actually now, without amplifying the myth, can express empathy. Holy crap, that would scare the hell out of me if I thought that was true. Can I tell you why I got my kids vaccinated? Or can I, whatever. The two things you don't do is what Alex said. You do not throw, well, let me show you a scary picture. Do you know how many kids die if you don't get this? If you throw fear at somebody that's already questioning, they will become more resistant. And this is communication research. The other thing is we tend to go, well, let me tell you, there's a study, 95% confidence intervals. And if you start throwing data at them when they're questioning, they will also oftentimes become more recalcitrant to the recommendation. So announce, inquire, mirror. And then if you can't get, she goes, I just want the first and the third today, secure the relationship. Thanks so much for talking to me today. You know what, we'll talk about it next time, but I really appreciate the opportunity to talk about Susie. And I'm so thrilled you brought her back today. Okay, why are the anti-vax attacks and the anti-science attacks occurring? Because the algorithms, as you've heard, are just juiced for disinformation. But this other attack now is on the vaccination advocates who are speaking up, like Alex, myself, like the people in TIOS and shots heard and everything else, which is why we're fighting back. So we realized after being attacked, it was terrible to be a victim. We weren't going to be the last, that better resources were necessary, and that even big practices and systems were being shut down. So we launched a 4-prong counter response. As you saw, we did research. We created a toolkit, which has now been revised, edited, and now translated into Spanish, French, Portuguese, and English. We have a digital cavalry that's global. So if you're being attacked, if we are made aware, we like the signifiers of Gondor and the pro-science riders of Rohan come to your social media page in real time to protect you. And we've done an awareness campaign. Yeah, this is what they try and do. And I'll tell you, if you're a victim of the attacks, it's pretty scary. There's vitriol and hatred and just all sorts of ugliness. And they now smear your reputation, which is pretty terrible because that can actually cause financial harm. And so the whole point of what Shots Heard was, and we eventually turned it, as you saw, into a nonprofit, was to do all these things. And we now have a global team. And we also have connections at really high levels in the platforms themselves, the social media platforms, trying to turn the tides. This is, we handed off Kids Plus, basically created Shots Heard, but we handed it off to a large nonprofit called Public Good Projects, which already had, they have a lot of other healthcare related public health issues that they tackle. They're amazing. They were doing Project Vector, Vaccine Communication Tracking and Response, and also stronger.org. We then turned the keys to the car over for Shots Heard. And then, as Alex was telling you, Vaccination, and this is our shot. Also now we're in that same portfolio. It is really, I think, the most robust vaccination portfolio around for a nonprofit. I will tell you that their efforts are now leading into new services to try and help healthcare providers and systems with really tackling this challenge. And I think they are now forming it under this Health Defend model. So really the enemy now is not, malignancies and viruses and bacteria, it's this stuff. But also I want you to know that the anti-vaccine industry uses narrative, and we should use narrative. They say, oh, we're protecting your liberties and keeping government out of your decisions, or keeping you safe from toxins and chemicals. And by the way, if you haven't seen the crunchy left or the hard right maneuver, it is going on. Check out some of the social media pages. You think, oh my God, they'd kill each other, but they're kind of aligning. Anyway, what they're really doing is pushing disinformation because they profit, they gain politically, or they gain power or popularity. And that includes hostile foreign countries that push disinformation. Can't go too much deeper into it, but it's happening. So we should tell that story and use narrative. This is just one example Paul Offit used at the AAP national meeting this year, saying the use of the word breakthrough was a devastatingly bad choice of words, and thus how every newscast and all the anti-vax industry said, look, COVID vaccine doesn't work, there's breakthroughs, when in fact, it was never expected that every infection would be blocked. It was expected that we would have a vaccine that was safe and effective and really worked well at preventing hospitalizations and death. And actually, the vaccine exceeded all expectations, the mRNA vaccines. But he was right. Communication matters, and that was a terrible term to use. Just so you know, we are really doing lousy at vaccinating kids for COVID. Those are the numbers. That's pathetic. You basically have like less than 5% of people, maybe it's up to 5% of kids less than 5 that would say, I'll take my chance with that virus versus the vaccine. Based on what? Based on they've been scared by disinformation and political embracing of anti-science platforms and things like that. But that's where we are. What are we doing to change things? So we should be, again, harnessing this tool, which is our digital connectivity, to create behavior change with good communication skills. And I'll say that we now have obviously well over 1 million deaths. And are we doing no harm? And I would argue, no, we are doing harm. We are knowingly abandoning our patients because we know they're here and this is where they get their information. And we hide behind, well, we wait till they come into our office. I think we're abandoning our patients. So call to action is we really need to change how we communicate. All the trust is up there on the top. You've already heard me talk about it and Alex talk about it, but are we changing how we train our health professionals, not just physicians, nursing school, pharmacy, public health, respiratory therapy? We all have great trust. And if you go onto some of these accounts on social media, you can see they can be used for good or evil. Why aren't we taught to use it for good? Why aren't we trained, supported, and protected? That's really where I think the next step's got to be. I'm on TikTok now 95% of the time. Unlike Alex, I've really shuttered my Twitter. I have not deleted it. We can talk more. I saw there was a question about that. I'm also on there with multiple pediatricians, hashtag Ped Squad, check us out. And we were just part of a really cool documentary that I hope is coming your way called Virulent. It kind of summarizes a lot of this, and thank you.
You guys are awesome. This is really fantastic. My name is Eric Ball. I'm a primary care pediatrician with the CHOC Primary Care Network. I have worked with both Alex and Todd for the last few years now. I've seen you guys speak probably a half dozen times now, and you guys just keep getting better. We really appreciate everything you have to say, and you guys are great. Just some housekeeping stuff. These slides will be posted on the California Immunization Coalition website. And also this webinar, as well as all of our previous webinars, will be on our YouTube page, as well as our website. Actually, Doctors McDonald and Wolynn were in a webinar we did about 2 years ago on a very similar topic. So sadly, not much has changed, and we still have to fight the good fight. A few questions, a lot of great questions came in today. One that came in a lot was basically, and I think I'll start with Alex on this one. Where do you recommend you put your efforts? So especially if you're trying to target a certain demographic, depending on what kind of specialist you are or what have you. And then as a sub question, what do you recommend for people like me, say, who tend to live in the Twitter space, which tends to be falling apart now? I mean, I've already started a Mastodon account and a Post account, and is everyone going to migrate to one place or another? Or so if you're just starting out, where should you put your time and effort? I'll start with Alex.
Yeah, I mean, I think it depends on wherever you're most comfortable. I mean, start with where you are. I mean, if you already have a Facebook account, start there. If you're already a member of the PTA or your local religious group or whatever, just start where you are currently. You don't have to create a new account or a new profile. I think a lot of this is about relationships. And building in that trust building over time as well. We know that the healthcare professional is most trusted, but even more trusted is actually somebody who is like you. So somebody who shares your same kind of age, demographics, community interests. That is actually probably the most trusted messenger too. So whatever groups you're a part of, that's where you should start essentially. When it comes to social media specifically, just pick one. If you already have a Facebook account, start there. If you have a Twitter account, use that cautiously. Or if you're under the age of 30, you can start TikTok. Although Todd, I'm impressed that you have a TikTok account. I didn't think it was genetically possible for those of us who are who have a 4 or 5 at the beginning of our age. But anyway, I digress.
It is. TikTok's a lot of fun. The Twitter question's a tough one, to be honest. You know, the problem is, like, if you've cultivated and grown your Twitter presence and that's where you've put your time and effort, I totally get not wanting to abandon that, nor the people that follow you, because they're going to really have one less voice to hear. It's easier for me because I had started migrating over to TikTok in 2020. And so my personal feeling is, for me, I don't want to continue to support it by using it. But then again, I wasn't using it that powerfully. And so it's one less account with activity because it's measured on activity. But I also didn't want to totally jettison it because your account and your handle could be taken over and other things. So, it's a personal decision. You need to decide what you want to do. But it's some really nasty stuff going on there right now. Yeah.
But I also think if we leave Twitter, they win, right? So that's the issue also. If we allow these tactics to silence us, they win. So that's part of the reason I'm not leaving Twitter, is because that even more reason why we need to have that reasonable, not crazy, over sensationalized voice as well too. So again, it's a personal decision. There's no right or wrong answer. Me personally, I created a Mastodon account. I haven't actually used it because I think I'm going to stay with Twitter and continue the fight.
And Mastodon obviously has some of its own limitations because of its decentralized nature. So I agree. It's personal decision. I didn't get rid of mine. I'm just really currently not using it. But again, have fun with it. Make sure you're on a platform that feels right. And that I think that you can reach people. And personally, if you're a healthcare entity, a practice, a provider in a practice, survey your families. Who are you trying to reach? I mean, make sure what you're doing is relevant. And I kind of speculated that TikTok was really growing at that point. I wasn't that early of an adopter, but I was early enough that, I feel like I'm reaching who I want to reach on that. Also, I will point out, every one of you personally, this is my own personal feeling, should have a LinkedIn account, because it's just your business side. And I would tell you, whatever you do on any other platform, you can just paste. But if you really want to connect professionally and get past layers of voicemails and assistants, it's a really cool way to meet professionally with other people. And I've done really cool professional meetups on TikTok too, and Twitter. I'm just saying, I think they're very different audiences, and I think it can help every one of you in your professional careers.
That's really good advice. Lot of questions about what do we do about other healthcare professionals who put out misinformation, either knowingly or unknowingly. How do you combat that?
There are efforts right now. California, you guys have laws. I think one of Richard Pan's last pieces of legislation was to try and start holding people accountable for pushing disinformation. So I will say, I think that's the right thing. I mean, I think it's kind of like what they call the blue wall or whatever. Oh, police don't report their own. Do we report our own? I mean, there are people on a variety of platforms that do pretty aggressive calling out of providers. And honestly, they are taking the trust and the importance of our profession and really using it for evil. So I think we call them out and hold them accountable.
Yeah, I think those are sometimes our worst. I don't want to say enemies, but those are the people we are trying to fight the most, is other healthcare professionals who have been sort of manipulated, quite frankly, by mis and disinformation, and even the kernel of distrust. Like I said, to get somebody to do something is a lot higher threshold to cross versus getting somebody to do nothing. And so a lot of really, honestly, very reasonable people that I know and I call colleagues have been manipulated, quite frankly. And so having that conversation, I have a regular text thread with one of my colleagues. I don't want to call them a friend, a colleague who has literally gone off the deep end and is like total conspiracy theorist. And he sends me text messages and articles all the time. And I just continue to engage and have that dialogue with him and be like, well, here's what I think. And this article is from 10 years ago. And, just continuing to spread, not necessarily poke holes, but continue to engage in that dialogue too, because just like with an individual and a patient, we need to build that trust and that relationship over time. We need to do the same thing with our colleagues as well too.
And how to engage people when they are when they are swayed by disinformation, as Alex is saying, is to have conversations and to ask questions. I know, and I have it too, this inkling to show like you're wrong. And you decisions like that are made not on intellect. They're made on core values and beliefs. And what you're doing basically is if you're trying to convince them they're wrong, you're actually telling them they're like not like their core beliefs and values are wrong. So there's strategies and communication tactics to really get people around to hopefully seeing it. I will say to Alex's point, people that are truly swayed by misinformation aren't enemies per se. Hopefully we can salvage something there, but people that are gaining purposely from profiting or politically gaining or gaining popularity and know what they're doing, they're enemies.
To be respectful of time, it's just about 1 o'clock here on the West Coast. Again, I wanted to thank you guys so much for your time and efforts here. You guys are fantastic. I'm going to throw back to Margaux, who will give some closing comments. Thanks a lot.
Thanks so much, Dr. Ball, and thank you so much to Dr. Wolynn and Dr. McDonald. We really gave you a tough challenge with 20 minutes a pop. So thank you for all that you were able to communicate in that very brief time. I think based on the questions alone, this warrants a secondary conversation. But just to wrap up today's conversation, again, thanks so much. We will have an evaluation that's going to pop up on the screen. It should take about 5 minutes to do it. And then just to reiterate, I know a lot of people asked this during, so we want to make sure you know there will be a copy of the webinar recording. It will go up on the website, and then also it will be accessible through YouTube. And then there'll be a copy of the webinar recording, yes, on the Immunize CA website, and the slides as well. I think that's what we're also seeing here too. The slides will be disseminated to all attendees too. So it is 1:01. Thanks for hanging on a little long with us. I, for one, didn't want it to end. I know, so I know we have so many things to talk about, but I really, really appreciate, and we all really appreciate all of your expertise. I think it's so keenly felt now more than ever. There's, as you both alluded to, there's such a need. There's not readily available education in this area. So I think our community is very hungry to become educated and learn more and engage more with these ideas. So thank you both so much for the work that you do, all of you on the call today. And thank you again, just for your time and for helping us to build up that vaccine confidence.
Thank you.
Thanks, everyone. We'll do part 2 later. Just I'll free up my schedule, make some time for you guys.
I'm there. I'm ready. See ya.